Greetings, y'all. It is fall, and as a nomad in a certain demographic, that means open enrollment for Medicare. I crossed the threshold into that system last spring. Through repetition of information, you learn that there is Plan A, which covers hospitalization, and then Plan B, which covers health care, and that's just the beginning of the alphabet soup that you have to navigate through. There are professionals who provide support in determining what plans you should buy based on your individual situations. And I did reach out to one at the beginning of the process, months before I turned 65, and they suggested a certain choice. And then, of course, I needed to do my own research to see if that's indeed the right way for me to go. There are some pockets of user profiles, I guess, that make some choices inevitable, but I kind of fell in the middle where I don't take any medication and I don't have relationships with physicians that I would be taking on the road with me. So after months of research and speaking to the state entity that is responsible for the vetting of companies that are offered on the Medicare website for your zip code, I did indeed go with Supplemental Plan N and a no payment prescription plan that this original had recommended. I fit the profile, being a nomad, of having the option to see any provider who accepted Medicare anywhere in the country, which is a big plus for somebody who travels all the time. Then there's the very serious penalty you pay if you don't have prescription drug coverage, either under a separate plan, and the one that I chose doesn't cost me anything right now, and obviously the coverage is different than a plan where I would pay a very heavy premium for, which if I were taking lots of prescription medication would probably be a really good idea. If you don't sign up for drug coverage, either through a separate plan or through an Advantage plan that has that as part of it, you will be charged a fee when at some point you do sign up for that coverage because you need it, and you pay that fee every month for the rest of your life. So don't do that. I decided to choose a doctor to have as a primary in the system, with the eventual plan of being able to reach out for telehealth visits when I'm in the state that they're licensed for, and reestablish a baseline for what my health looks like according to their numbers. After having shifted my home base to a major metro area, I just didn't feel comfortable dealing with huge systems. So I started Googling physicians to find their ratings from current and past patients, looking for a good fit with what they say in their bio about who they are as physicians. And I landed on one in a small town, in a small network, and signed up for a new patient visit. Because I don't take medications, because I eat pretty well, although maintaining eating regimen that doesn't involve processed food is really difficult on the road. I don't care how much of a real kitchen setup you have in your rig, it's still pretty challenging. And I exercise moderately. It wasn't a lengthy visit, and consented to some of the tests that she wanted me to take. I agreed to some basic blood work to reestablish baseline of blood sugar levels, cholesterol, thyroid. The results that I've gotten so far, blood sugar's a little high, cholesterol's a little high, but to her credit, my doctor didn't immediately prescribe something like a statin, and instead recommended what I would have done anyway, is to amp up omega-3s in my diet, which I've done in the past and understand how that works. So those were positive. Also a DEXA scan to determine the condition of my bones and how brittle or not they are. Mostly because having a friend who's come out of about a 1.5 year experience, luckily on the other side of initially being diagnosed with extreme osteoporosis and just being the person who she is, doing all the research, finding out what actually works other than medications that are questionable in their side effects. She's done all the things and gotten much better. I didn't think I was a candidate for that, but just wanted to find out for sure. Also, I'd never been to a dermatologist before, and I had some areas on my arm that could stand a looking at, so signed up for that as well, or got a referral. And a colonoscopy. My brother had one recently and had a couple polyps that were removed. So it's like, okay, I can do that. DEXA scan normal. I've been to the dermatologist. One of the spots he called boring. Don't need to do anything with that. And one spot they did a very minor peel of the skin for a biopsy, and I'm anticipating that those results will be normal as well. For whatever reason, scheduling a colonoscopy requires a lot more lead time than anything else. So I have another month or so to wait. And one of the positive uses of technology has been my experience with patient portal apps that allow quick communication with the doctor's office and the doctor themselves. That has been astounding to me, how quickly test results turnaround are, and the ability to communicate with your physician in real time, really, depending on how busy their schedule is. And then I'll be done. What I initially resisted in participating in just slowly dipped my toe into figuring out all the parameters, and thank goodness landed on a great practitioner that I felt comfortable with and felt in charge of my own healthcare, which is supposed to be the point, in my opinion. And now I will do the same in Arizona or Nevada. I'm anticipating that physicians in those areas are dually certified in both states just because of the need, and I'll have a source there to reach out to for televisits should that need arise. Now that I've gone through the process, I'm more comfortable with it, know what I want to look for in variables, so I feel pretty good about that.
Thanks for taking the time to be here with me, and we'll see you down the road.